our panelists are Jane Stevens, who is CEO of the Suffolk User Forum, which is a user-led service which aims to improve emotional well-being and mental health of people across Suffolk. Dr. Dan Dalton from the Norfolk and Suffolk NHS Foundation Trust. Dr. Rosalind Tandy, GP, mental health clinical lead for West Suffolk CCG, the CEO of St Nicholas Hospice, and Fanwell Mutamburi, Business and Operations Director for the Ipswich and Suffolk Council for Racial Equality. So good morning, everybody.
Morning.
Morning.
Thanks for joining us. And I hope you're joining in with some of those exercises as well.
Oh, absolutely.
In my chair.
So just for the people watching, we're as I've just said, we can't see you, we can't hear you, but if you have any questions during this discussion, please feel free to use the Q&A button at the bottom of the screen. You can put a question forward, and we'll get through as many as we can. So I'm going to start this by just asking quite a general question, and I'll put this to Dr. Dan Dalton first. So Dan, what are your observations about the last 12 months, the impact on mental health, and how have we coped with those challenges?
First, morning, Brad. Thank you so much for having me here, and hello to everyone who's with us. It's great that we're able to talk about this, and I guess that's the first thing that I wanted to say. I think it's been fantastic that, although it's been an incredibly difficult year, I think we've all come to the place where we can now say that it's okay to talk about feeling anxious, and that it's normal to not feel okay under extraordinary times. I think we've got to a place where we now know that, you know, physical and mental health, they're all part of the same thing, that you can't find well-being without having your mental well-being and your physical well-being at the front of your mind. And actually, when people are feeling physically unwell, that affects their mental health too, and that we need to talk about that and support each other. I think what's been really amazing is how over the last year, everyone has pulled together. So, you know, we've worked so well with our GP colleagues, with people working in charities and with communities, and where we haven't been able to do that because of the impact of the pandemic and lockdown, goodness me, we've felt it. It's been so hard for people not having that community support. So I think we're now coming out of this saying community really, really matters. We're all in this together, and that mental well-being is about strong, healthy, solid communities pulling together and supporting people where they live. And then I guess the other thing that's come out of this is realizing just how amazing everyone who works in health and social care and the voluntary sector is, that people have really appreciated the gratitude and positivity that healthcare support staff and everyone else has brought, but also that these are human beings who have their own needs, and that if we don't treat our colleagues and people who are working in these places with compassion and care, we'll never get the best possible mental well-being for everyone. And it's just been wonderful to appreciate and see the appreciation for people. So I think there's a lot that we've taken from this that we can feel hopeful about. We've just got to stick with it and make sure we don't lose the benefits.
Absolutely. I think everybody would echo what you said there about what NHS staff and care staff have done in the last year. I'll put the same question to Jane. Jane, morning.
Morning to everybody.
Jane, just talk to us about what your observations have been over the last 12 months about how we've coped with this extraordinary thing that's happened to us.
I think I'll probably echo much of what Dan has said. I think overwhelmingly we've all experienced COVID, but what we've been very aware of is how people have experienced it so differently, that there's been huge diversity, you know, from people who have valued being furloughed and actually enjoyed the time off with their families, to families who have been under extreme pressure, maybe trying to work at home with both partners working and doing home education. We've seen an increase in mental health problems, certainly. Seen an increase in domestic violence and young people reaching out for help because of child abuse. We know that people with long-term conditions have had to live in more pain and discomfort because health services have been understandably redirected to supporting COVID. And I think also we don't yet know the full impact of the social and economic sort of climate, you know, those people who maybe are facing redundancy. From our perspective, I think we understand that when there's an economic downturn and people are struggling with debt and with feeding their families, that inevitably they are sort of determinants that affect people's mental health and well-being. Certainly, I think the strength, as Dan has said, has been communities working together, an understanding of the health inequalities that have impacted on people throughout all this time, and an understanding of the risk of certain groups of people to suicide, because we do know when there's an economic downturn, unfortunately, death by suicide does tend to go up. And certainly our partners in the NHS and the local authority have throughout this time worked so hard to bring about new services. They've certainly supported the VCSE sector with more funds to support more vulnerable people. And there've been a real willingness to listen to people within our communities to respond with new services. So I think, as well as understanding some of the things we don't yet know the full impact of, we have to recognise the huge effort that's been across our communities to support people.
Okay, thanks, Jane. Thanks. And I'm going to the same question. I'll put the next one to Fanwell. Fanwell, what's been your insight into the last 12 months or so?
Thank you, Brad, and thank you for everyone joining. Yes, I mean, like others, I think, you know, there's been quite a lot of positives that have come out of this, you know, very dire situation. And one of those things has been how people have actually pulled together and supported each other, you know, during these times. We've learned quite a lot about our communities. More often than not, you know, we talk about resilience and we talk about how we need to teach people resilience. But I think from this, we've learned that actually we need to learn from our communities, because they've shown us that they are very resilient and they are able to cope with the waste that, you know, this pandemic has thrown at them. But we can't deny the fact that particularly some of the people that we work with from our minority ethnic communities, we have seen the numbers, we've seen the disproportionate impact on those communities, and you know, that is not just confined to, you know, the number of people dying, the number of people losing their jobs, and other things. It's also the mental the impact on people's mental well-being, you know, that all this has caused. I mean, we have been having discussions on things like you know, some of the rituals that people perform when they lose loved ones, and they haven't been able to do those things because of, you know, some of the restrictions during the pandemic, and that is going to impact people. And like, you know, what Jane has said, we don't know the extent to which, you know, this impact is, and we need to continue engaging with our communities. But I think going forwards, there is something also, you know, very positive that has happened, which is the way we have engaged with our communities. We've listened to people, we've given them time, we've, you know, asked them what works for them. But I think it would be amiss if we lost that learning, because what tends to happen is, as we step out of this, we forget about some of the benefits, you know, that we've derived, and sort of, you know, revert back to the way that we've always been doing things. I think we need to maintain those relationships we've built with our communities and start building together with them going forwards.
Yeah, I think, I mean, it's interesting. The three of you that I've spoken to so far, the one thing that does come across, and I think we have all seen this, haven't we, is the way people have pulled together, people have supported each other, as you know, as much as they can, and the kind of slight worry that you know, as life starts to return to normal, actually for a lot of people, actually the economic impacts, the social impacts of this are going to deepen for a lot of people over the next 6 months, over the next year. So how do we make sure that people don't lose sight of the challenges that people are going to be facing? I'll put that question to Barbara. Do you have any views on that?
Yes, I think we have to keep the conversations going. So I think there have been one of the advantages that I've seen. So I agree with everything that everybody said, but I've also seen that we've met together more easily rather than having to travel, you know, meetings on Teams and Zoom. We've developed relationships across the county, had conversations with people that we might not have been able to have conversations with. And I think we mustn't lose sight of that and keep listening. I think, you know, we've done these listening exercises to hear what's important to people. And we mustn't forget that now, because I think for some people, their experiences are going to continue to be different. I mean, Fanwa talked about rituals for people, but we've certainly in the field of death and grief, it's been so hard for people that they've been separated from their families and friends and communities. And they're, you know, the people that would have got you through, it was much harder to have that support around you. And I think that that's still going to stay with people, the endings that they've witnessed. You know, how you die lives on in the memory of others forever. And I think we know that in the hospice world, but that's really been heightened for some people. So there have also been other people that, because they were isolating together, they had their family around them. And because those family were furloughed, they could help care and support. So again, there are those differences of experiences that we've now really got to listen to and think about what we need to do differently as systems and professionals and caring organisations. I suppose I'm also mindful of charities going forward and, you know, the income that's been lost, and then, you know, the charitable donations that many of us rely on, and how much harder that's going to be going forward. So I think it is, we're all going to be in a difficult place for a while.
Yeah, just a couple of points there, just going back to the isolation that's been involved, you know, with people not being able to see each other, you know. I mean, I don't know. That must have been very hard for the, you know, the hospice, for you to kind of deal with that and work with families around issues like that.
And so hard to be able to have, you know, where the hospice has always welcomed everybody, including the dog and the pets and the children and, you know, all the facilities we've got, to then go through a time when it was really at its height to restrict visiting, and the pain that caused staff, that they couldn't hug people, that, you know, you were having to say to families who can attend. And whilst we did, in exceptional circumstances, let more people in and manage the risk, there are still people not being able to travel, not being able to visit because of their own illness and their own vulnerability as well. So, you know, I think it's just we need that time to heal, all of us as well, professionals, volunteers, communities, as well as individuals. We just need to get ourselves through this together, really.
Yeah, and then there's absolutely, and then the second point was really about and we've written quite a lot about this in the in the newspaper. Charities, voluntary organisations have done an incredible job in the last year. We've seen it, but it's been really hard for as well, because of the issues around, massive issues around funding, quite big issues around staff and volunteers. So I think you're absolutely right. It's to get that's got. There's been a mass, like, lots of fundraising in Suffolk, but the voluntary sector needs some support, doesn't it, going forward? Some, you know, some sustained support.
And I think we are quite lucky in this area. We do have good relationships with our partners across the system, in the health, the council, and the voluntary sector. So we are around that table, and those conversations about funding and how we go forward are happening. Yeah. But I think it just, you know, adds pressure and uncertainty to people in those organisations, in those charities, and, you know, affects their mental health and well-being and how we support them as well.
Yeah, absolutely. Thanks, Barbara. I'll just bring in Rosalind now. Rosalind, morning.
Hello, Brad. You can call me Ros. It's much easier.
Oh, Ros. Okay. Hi, Ros. Can you just give your insight? So you're the mental health clinical lead and a GP with West Suffolk CCG. What are your observations over the last year?
Yes, thanks, Brad. So I work firstly as a GP, that's my main job, and then I also work in the world of commissioning and looking at services generally. And I suppose going back to sort of my clinical in general practice, and I think I very much agree with that story that particularly, you know, the other panelists have been talking about, that link with the physical and mental health, and the two being very much joined at the hip. And certainly that spirit of, helping communities and pulling together. And I think now the dust is beginning to settle. We are at that time when people are reflecting on what's happening and probably beginning to find it quite difficult sometimes to make sense of what's going on and how to be resilient and how to build a future for themselves. So certainly certainly in general practice, we're seeing a very large increase in requests for help for young people, particularly teenagers, who seem to have found it incredibly difficult when you think of the disruption to their life, having to often miss huge chunks of their education, losing all of their social outlets, their hobbies, being stuck at home. And a lot of these young people are really finding it difficult. So we're very much looking at how we can support those young people, and using what we've got within our system to sort of really pull together, and certainly looking at how services and organizations can be a bit more joined up. So for young people, it's often not one place or one thing that helps. It's often a joint approach. So it will require the parents, education, social services, health, general practice, all to work together. And I think that's the bit that we're really beginning to now start talking about and doing. So as you're probably aware, Suffolk has been going through sort of a large program of mental health transformation over the last 4 or 5 years anyway. So there has always been a recognition that we wanted to work in a slightly different way and make mental health everyone's business. And we were well on the way to doing that when COVID hit. And we decided that we would still try and carry on because the principles were sound and the way we were working was really sound, and we didn't want the pandemic to get in the way of actually potentially good work that we knew would be useful as we start coming out as well. So we've worked really hard to start setting up new ways of working, as Dan was saying, about bringing care into the community a bit more, having mental health support based around general practice, around schools, around where people live, and using the third sector as well. So Suffolk Mind has been a great organisation in terms of starting to help pick up some people who were on waiting lists. So we do have large numbers of people on waiting lists for secondary mental health services, and we've worked really closely, as has my colleagues in NSFT, to try and engage with Suffolk Mind and get them to support people more in community. So they've been setting up, it's like a brand new service really, where they've been phoning, supporting people all the way through the pandemic. And ditto Suffolk User Forum and Suffolk Parent Carer Network have been absolutely instrumental. And so the CCG are very much wedded to building in a lot more formal ways of commissioning and supporting the third sector. So you've just mentioned around the difficulty finding funding, where's that going to come from? And the CCG are now having a much more structured approach to supporting these organisations because they play a real part in transforming mental health and how we support people. And they need that security. They need to know that there is a forum and a board that's set up that allows them to issue their services safely and in a proper sort of commissioned and governed way.
Okay, great. Thank you very much, Ros. Thanks. Can I just go back on one area there? You mentioned obviously the impact on teenagers and younger people, and so as we start to come out of the last year and the pandemic, what kind of things can happen? What to support young people? What sort of areas are being looked at?
So certainly anxiety sort of has been a huge impact on younger people, and that's often had a knock-on effect on how they feel about themselves, their self-esteem, certainly their eating habits. We've seen quite an increase in presentation in odd eating habits that's centered around anxiety. And there probably isn't going to be one quick fix. But when I speak to parents, they're really keen, and parents are a key way of sort of helping and being part of encouraging these young people to start, getting back into the world again. And certainly, as I say, there's been lots of work done. Our mental health services within Norfolk and Suffolk Foundation Trust and the Younger People's Services have been incredible at doing lots of online resource, because really that is how we can communicate at the moment. I know it's not perfect, but they've produced webinars particularly for parents, helping to cope with young people with anxiety. There's also been, we're looking at a psychology in schools teams that's going to be rolled out across Suffolk. That's already started in some local areas. And so these will be particularly psychology teams that are very much linked in with mental health services, but are embedded in schools. Young people tell us that they don't particularly want to go to places like hospitals or doctor's surgeries to see people. That's generally what they say. They want either their care to be delivered to them at their place of home or school. So there's going to be a lot of focus within schoolwork. And I think the community plays a big part in this as well. If you think about it, pretty much everyone's hobbies have stopped. Anything that, doesn't involve, something that's a solo venture, anything like playing football or playing in a band or singing has kind of gone out the window. So it's about all those things that contribute to well-being. There's a good 5 or 6 boxes you have to tick to feel emotionally well, and it's about getting starting to tick those boxes again. Okay,
great. And Ros, I just want to ask you one more thing. Just in the intro that I gave to this event, I made reference to an ONS report which came out fairly recently, which said that the number of people who had reported, having feelings of depression had gone up to 21. It's about 21%. But said at the same time, the number of people actually seeking GP support for it had actually declined, because I don't know whether people were just accessing GPs less, probably not. But so have you got any kind of insight onto whether that's reflected in Suffolk?
So certainly I can speak for my practice. I don't have the figures for the whole of Suffolk, but certainly in my practice, we saw a decrease in all consultations between March and September. So at the beginning of the pandemic, it seems that people really battened down the hatches and they weren't really going to consult about anything. I get the impression that the population were either terrified or didn't want to trouble us. And I think that's probably where that came from. And then actually since September, certainly the statistics in our surgery have shown a steady increase in consultations and demand. And this is for everything. This is not, we don't separate mental health from other consultations, because it's not always easy to tease that out at the front door. But we have seen an increasing demand week on week since September. And actually the graph still seems to be going up. I'm hoping it will flatten down soon, because the 12-hour days are quite difficult. But certainly when it comes to mental health, I think now is the time we're beginning to see it. So I think people are beginning to come forward now and talk about the experiences. It's almost like the foot's come off the gas a bit. It's feeling a bit more safe to be out, to talk about things, to trouble the health services. And we are open. We've always been open for people. And actually there are a lot of services that are really ready and great at helping people. So the Wellbeing service, which looks at psychological treatments, talking therapies, they're primed and ready to receive these people, and no doctor needs to refer you. It's literally, you can go online, you can do it yourself. We have social prescribing, which is very much looking at, supporting people who are very lonely, or are trying to get back into sort of life, get back into work, and they can help. That is a referral service, but GPs can do that. So the GP is a great port of contact to sort of direct out to elsewhere. And so I would encourage people to contact us.
Yeah, great. So there is lots of help there, isn't there? It's people just can find it. People can come to surgery for advice. The Wellbeing service is there. So good. I'll just a reminder to all those who are watching, if you have any questions at all, please put them in the Q&A and we'll try to get through them. Right, I'm going to come back to Dan, I think. Dan, in your view, what are the challenges and opportunities for supporting people's mental health in the months to come as we come out of the pandemic?
It's a really important question, and I think it links to all the things you've been hearing so far. So I think the first thing I'd say is it would be very odd if people didn't feel feelings of depression and fear and anxiety over the time that they've experienced. And I think, exactly as Jane said, when we think about some people's lives that are going to have been affected financially, that's going to mean we'll probably see more people who aren't just experiencing sort of anxiety because of the direct impact of what's happened over the last year, but because of what that means for their lives. So I think people are going to need more help and support, is the first thing. There's also clearly a direct effect that a lot of people have had because of the COVID virus. So a lot of people have suffered from serious ill health and are still suffering, actually. There's a group of people who are affected by longer term symptoms of COVID, and that's both a mental and a physical challenge for those people, because it makes their lives really, really difficult. So there's some need to make sure that we've got great support for those people and understanding. And then I think, as Ros says, there's something about how we make sure that people who have lost really important support networks and are feeling that they're needing something to replace that, have it in place. And for children and young people, the impact has been devastating. And it always is, unfortunately, children and young people and people who are least well supported in society who are most badly affected by things like major disasters and significant incidents, because they're terrifying for younger people in some cases. And often what we do is we assume that young people are resilient and bounce back and they're okay. And actually what we need to do is say to people, it's all right to not feel okay. Doesn't mean you've got a health problem, but it does mean that things are really tough at the minute. So I think we all need to prepare to pull together to do a bit more. I think we need people to know that feelings of depression doesn't mean that they've got a problem that can't be helped. It doesn't mean that they're ill or need medication, but that there are great services available, and Wellbeing is fantastic, and it's just there for people, and there's plenty of opportunity for people to get the help and support they need, but also to keep thinking about how, whenever anyone's looking like they're under a bit of pressure, we all ask how they are and check in with them and make sure that we're providing them with the support that's needed. I think the other thing that really matters is exactly what Faniel said, which is that we need to make sure that the people who've suffered most because they're most disadvantaged, so people from communities that we don't support well, and where actually we know that it's us that needs to reach out better and meet these people's needs better. People with severe mental illnesses, people from minority ethnic backgrounds, people with learning disabilities. These are the groups of people who've suffered worse during this pandemic, and we have to make sure that we get the support wrapped around those people for their mental and physical health, and see what we can do to ensure that they can access the services that we perhaps haven't always offered for them in the right way in the past. So there's a lot of challenges for us as people working within the system, but underneath all that, as you say, there are opportunities, and a lot of those are about building on what's worked, making sure that all those things about how we communicate with people, the flexibility that meets everyone's needs, and the opportunity to use things like video conferences to make more contact with people, we keep up that sort of stuff, because I think it has been great when it's worked. It doesn't work for everyone, but it's a great sort of step forward in doing more for more people.
Great, fantastic. Thanks, Dan. Fanuel, can I just bring you back in on that point? How do we make sure that happens to reach some of the people who have perhaps been worse affected in the last year?
Yes, thank you. And I think I'll start on where Dr. Dan sort of finished there. In the most important thing is to recognize what people have gone through, particularly the disproportionate impact that people from these backgrounds has been. And I suppose, I mean, even prior to the pandemic, we had situations where you look at numerous reports, the government's sort of race disparity audit saying people from minority ethnic backgrounds are more likely to be in persistent poverty. You look at numbers and also some of the information around the health inequalities that have had been affecting people from those backgrounds prior to. And then we come into COVID. We then have situations where even where government was putting in interventions like the fellow programs, we've got disproportionate number of people who are self-employed, people who work in drive taxis, work in restaurants and other places where some of those programs were not supporting those communities. So it's recognizing that there has been this disproportionate impact on those communities. So as we start to build back, it's about that differential investment, which recognizes that if we are going to create a fairer society, some people are going to require more support than others. And I think we are hearing all this talk about leveling up, and it's not just about the regions, it's also recognizing those people who have been, and if we're thinking about a fairer society, it's about looking at what are those specific needs. And again, there are things that we've done which have worked. I mean, here in Suffolk, we saw that vaccination bus that was going around to different communities, having those in-depth conversations with them, and we managed to get some people who were hesitant around the vaccine vaccinated, because we were giving them that opportunity to. So what is going to work as we come out of this is co-producing solutions with those communities. We can't have a one size fits all solution as we come out of this. It's about even when we come to messaging, it's about creating those culturally and religious appropriate messages bespoke for the different communities, and listening to them and acting on the feedback that they are giving us. So we have created, I think, a base for that with the way that we've been working. It's now just building on that and making sure that no one is left behind.
Great, thanks, Fanuel. So it sounds encouraging, but there's more work to be done to kind of see that through in the coming months, really. Okay, thank you. Jane, can I bring you back in? Just going back to the question, what are the challenges and opportunities for supporting people's mental health in the months ahead?
So I think the challenges are that many things have relied on virtual systems, Teams and webinars, that there are a significant number of people who aren't connected in that way, who don't have smartphones. And so they can be and have been more isolated. There has been extra support for some of those people. So, for example, we've been funded over the course of the last year to proactively contact people, to go and meet them. We've taken people for their COVID jabs. We've taken people for specific appointments. But otherwise, they would have been quite cut off. We've stayed in contact with them through writing to them regularly and so forth. So I think it's utilising the strength that we have of wider opportunities that have benefited people. So some people have preferred virtual meetings because it saved them the anxiety of travelling to places they don't know, for example, but also keeping a mind on those people who aren't able to access those kind of services in that way. And I guess it comes back to what we've been talking about already, really. It's listening to understand individual needs and being able to be flexible enough to provide services that can meet people's needs in a range of ways, so that it's not a one-size-fits-all. I think we've certainly been able to do some of that, but I think we need to do more of that as we move forward and connect better to people in their communities and actually connect people better within their communities. I'm very aware that some people are probably quite fearful of coming out and meeting people again, and that there's been such a gap in doing that. And it's supporting people to feel confident and able to reconnect.
Absolutely, yeah. We do have a session a bit later on today on post-lockdown anxiety, which I think John from Suffolk Mind is doing. So that's going to be for anyone who's watching, who's interested in that subject. Please tune into that one. And Barbara, I mean, the same to you, really. So looking ahead, how do you see? What do you think the challenges are going to be, and what are the opportunities?
So I think that the challenge is, I think there is going to be an increase in need if we're seeing more people who perhaps haven't sought treatment. I think I know GP colleagues are seeing more people with more serious conditions. So I think there's going to be more need for support for people as they're facing very serious illnesses or bereavement. But I think the other thing that we've picked up during the last year is perhaps sometimes how ill prepared people are for what might happen, or conversations they haven't had with their family. And this is actually Dying Matters Week as well, where there's a whole national programme about encouraging us to talk about what is, a certainty for all of us. But that doesn't mean to say that we can't have conversations with what's important to us, what would happen, what we would like to happen. I think families that hadn't had those conversations and suddenly somebody was rushed into hospital weren't quite sure what they would want to happen in relation to their treatment and their preferences and where they would want to be. So I think what we do need to do is perhaps help equip people to have those conversations the way we try and equip people to support each other through mental health, but equip people to have conversations about the end of life, the way we have them at the beginning of life. We prepare women for birth with videos and books and classes and things like that, and the physical demand of caring we prepare women for. And there are real similarities when you're caring for somebody who's dying, but also being prepared for what grief is like. Grief is hard work. Grief is painful. You need people who are, it can be lonely, but you needn't be alone. You need people around you who'll listen, who'll let you talk and scream, or bring you some food, or help you with the shopping or the children. And I think the communities have rallied like that. We just need to help encourage people to use that support, and communities to rally around them, because grief is normal. And I think particularly thinking about what's said about young children, again, people think hospices it's just about the building, but we support children, young people, schools, teachers. We support our communities. And again, to ask for help early, ask for advice early, ask for some tips. There are lots of things that we can help people with to make that experience not necessarily better, but better than it could be.
Yeah, great, thank you. I think that kind of community kindness that you mentioned, we've seen so much of that in the last year. Sadly, if you go on social media, you then see the other side of life. So I think that maintaining that community kindness is definitely something we need to capture, really. We've got just over 5 minutes left. So again, final reminder to anybody who wants to ask any questions. You've got 5 minutes. I'll just go back to Ros, and then I'll go to Dan. I think just about what tips do you have, really? If we were, this is a day about improving people's mental health and well-being. What tips do you have?
So when I speak to people on the phone in general practice, I often ask them to think about being kind to themselves. So I think that's one of the top tips, is just to take stock. I think we all have really quite high expectations of ourselves, how we should be feeling, what we should be doing, how engaged with things we should be, how much social life we should have. And I think it's about taking that step back and looking at our lives. Making small changes actually can be a really good step. And I often go onto the Wellbeing website and show them the 5 ingredients for well-being, and just talk through those. So one of them is about connecting with others, and if we're not connecting with others, our well-being is going to suffer. So I'll often talk about how can, are you connecting with people properly? Is that something you could start doing a bit more of now that measures are relaxing and you could meet someone outside? Are you learning? Are you keeping your brain active? A lot of people, I think, have sort of dropped a lot of the things that they might used to do to keep themselves stimulated. How can we look at those things? Are you doing anything that's voluntary or helping others? That's a real tick box for well-being, that thing that you're being useful to somebody else. Could you help an elderly neighbour that might need some shopping doing or some gardening doing? And are you living in the moment? Are you able to try and focus a bit more on what's happening today rather than all those things that you haven't done or you should be doing? And just trying to take some time. I think we've started doing mindfulness in our GP surgery. Actually, we had one of our nurse practitioners is trained in mindfulness, and we had a half-hour session on Zoom before surgery, and it was brilliant. And it was just about taking 10 minutes to focus on your breathing. And I say to people, we pay a lot of money to join gyms, to work out and improve our physical well-being. So we should be spending the same amount of energy and time on our mental well-being. So that will involve maybe 20 minutes 3 times a week on meditation or mindfulness or being outside, going for a walk, helping your neighbour. So it's about thinking about those ingredients and looking at your life and thinking, actually, I could make a change here for my own personal well-being, and we can all do that, myself included.
Yeah, great answer. It's really difficult, isn't it? Everybody has busy lives, and you stop recognizing those things that you need to actually feel well and feel good about yourself. And some really good advice there. Dan, have you got anything else to add to that?
Well, I mean, firstly, just to resonate exactly with what Ros is saying, I mean, the 5 ways to well-being, they are your 5 a day for mental health. So, I mean, if you can have those in your routine, and routine is another really important part of being well. I mean, having some predictability is important for people. I mean, some people like more than others, but some routine makes a big difference. It can help with sleep. It can help with, just feeling a bit more in control and a bit less like the world is kind of taking over. The one that Ros didn't mention is activity, actually. I mean, Ros talked about the gym, but actually the gym is a good way to mental well-being as well as a good way to physical health. But even better than the gym, there's pretty good reason to think that if you get outside, particularly where there's some greenery, I don't think anyone's quite explained the why of it, but being outside in greenery when you can see some trees is definitely better for you than being stuck indoors or plugging away on the treadmill. So if you can do it, and I know during lockdown that's been a massive challenge for some people, but if you can, then looking at some leaves makes a big difference to your mental well-being. The other thing I'd say is, there are things you can do to make it worse. So I think often all of us are tempted and probably fall into the habit of, for example, having a couple of drinks or something to help us through a stressful time. It really isn't a good way of dealing with your mental well-being. And I think although it can give you some temporary respite, it's pretty clear that, alcohol is not great for your mental well-being. So without wanting to be hypocritical about it, I think keep things moderate and, stay active.
Yeah. Okay, great stuff. Thanks, Dan. I think one of the big themes of the Mental Health Awareness Week this week is getting out, reconnecting with nature and getting out in green spaces. So good advice. Right, we've had a question from Audrey. Thanks, Audrey, for the question. I'm going to put this to you, Jane, just to give you a warning. We've only got a couple of minutes left. So should there be more informal support groups and communities, especially for those who don't use IT or live close to family? Good question.
I think there does need to be more informal support. Certainly, there's more going on in our communities than we can sometimes realise. I can see that Audrey's connected with some people in her local community. I think there might be more opportunity now that we are able to meet up a little bit more outside going forward from Monday. I would probably suggest, in terms of thinking about how Audrey can connect, that might be through maybe a local nursery school, for example, or a preschool group, if she wants to look at working and supporting other families near her. The other organisation would be Community Action Suffolk, who have a Good Neighbour scheme. That's not operating in all neighbourhoods in Suffolk, but it's operating in a great many of them. So initially, that's probably where I would connect her to. But if she wants to contact us at Suffolk User Forum, I can have either myself or somebody else can have a chat with her and look through what might better help her.
That's great. That's great. Thanks very much, Jane. Right, I think that brings us to a conclusion. So I just want to say thanks so much to all our panelists for their insight, their expertise, and for talking so honestly about the last year and what we all face going forwards. I think that's been a really interesting conversation, and I hope everybody watching it has taken something away from that as well.